This is the heat map that we've been showing throughout the weeks, and as you recall, we were hovering between, the country was heading between 92 and 94% of the counties in the high transmission rate. Luckily, nationwide, the case rates are declining. It looks like a lot of the case rate decline is in the southeast. We have seen a decrease in the case rate, but we're still in the high transmission rate per CDC criteria in the northwest. Looking at the case rate curve, it continues to drop off. Likewise, nationwide hospitalizations and deaths are declining, which is good news. Looking at CDC data across the country, we do see that most cases are in people who are unvaccinated, reinforcing the fact that the risk of dying is greater if you're unvaccinated. This is a slide showing hospitalizations are much higher in the unvaccinated population throughout the U.S. as well, creating a compelling case to get vaccinated. I'm looking at the Washington State case rate. It has plateaued a little bit, and we're seeing the same phenomenon in the Walla Walla case rate curve. We've talked before about the reproductive number of COVID, and we were below 1 for a while, and that's when we saw our case rates declined. Now the reproductive number is at about 1, so that explains why cases have plateaued. And the way that we draw down the reproductive number is through the mitigation measures such as the masking and distancing, but also vaccinating. The previous slide showed that you're 6 times less likely to get COVID if you're vaccinated. So just important to continue with our mitigation measures and continue to encourage people to get vaccinated. The Walla Walla hospitalizations, it has been difficult to get real-time census data. In general, the census has still remained relatively high with hospitalizations despite declining numbers. In the past, we've mentioned the fact that hospitalizations do lag behind cases, so hopefully that'll start to decline a little bit. I also want to emphasize that the majority of the hospitalizations are unvaccinated. In general, somewhere between 70 and 90% of the patients on the daily COVID census are unvaccinated. And with regards to our vaccination efforts in Walla Walla, we continue to edge up somewhere between 1.5 to 2%, depending on the demographic. In comparing ourselves to other Washington State counties, with regards to the percent of the full population vaccinated, we're about 14th out of 39 counties. If we look at 12 and over, we're around 16 out of 39 counties. So we're slowly increasing our numbers. Last week in Walla Walla, we had 5 Southgate clinics and 4 mobile clinics. The majority of these are the third dose or the booster doses. I'm going to try to get out of this here. With regards to upcoming events, we're anticipating getting approval to vaccinate those 5 to 11 somewhere towards the end of the week. Some buzz suggests that we might know by Friday. We were initially planning on starting pediatric vaccines on November the 5th, which is this Friday, but we've postponed that. I believe the schedule has been pushed out about a week. So as we kind of know the exact dates, once we get approval, we'll communicate that